You're watching Health Horizon. Subscribe, like, share, and comment to join our mission of better health for all. Welcome, everyone. Today, we're going to take a deep dive into one of the most important health and social issues of our time, drug abuse and addiction awareness. Now, when we hear the word drug abuse, some people immediately think of hard drugs like cocaine, heroin, or methamphetamines. But the truth is drug abuse goes far beyond that. It includes the misuse of prescription medications, overconsumption of alcohol, dependency on nicotine, and even the misuse of substances like cough syrups or stimulants that seem harmless at first glance. The reason this conversation is so important is because addiction is not just about the drug itself. It is about the human being behind it, the family affected by it, the community weakened by it, and the society that pays the price. Let's start with a simple story. Imagine a teenager named Amina. She grew up in a loving family, but struggled with pressure from school and friends at a party. She tried smoking just once to feel like she belonged, and in her mind it was harmless, but weeks turned into months, and suddenly that one moment of peer pressure turned into a habit, and that habit became a craving, and that craving became an addiction. Now her grades dropped, she avoided her parents, she fought with her siblings, and she started lying just to get her next fix. Now Amina's story is fictional, but it represents thousands of young people worldwide who find themselves in the same trap. So what exactly happens in the brain? When someone uses drugs, our brain is designed to reward us with a chemical called dopamine whenever we do something enjoyable, like eating good food, exercising, or spending time with loved ones. Dopamine makes us feel happy, motivated, and satisfied. Drugs artificially flood the brain with dopamine, creating an intense pleasure far greater than natural rewards. Over time, the brain adapts by reducing its ability to feel pleasure naturally. So without the drug, the person feels empty, sad, unmotivated, and restless. This is why addiction is not simply a bad choice. It is a rewiring of the brain's chemistry, and that makes quitting extremely difficult without help. The health consequences of drug abuse are massive. The heart can be damaged, leading to heart attacks, and irregular rhythms. The liver, especially from alcohol abuse, can be scarred, causing cirrhosis. The lungs suffer from smoking and inhalants. The immune system weakens, making the body more prone to infections. The brain faces memory loss, learning difficulties, and even permanent damage, leading to mental illnesses like depression and anxiety. And short, drug abuse slowly but surely eats away at both the body and the mind. But the effects do not stop with the individual. Addiction destroys families. Children grow up neglected or traumatized. Partners lose trust. Parents lose hope. Entire relationships collapse. Communities also suffer because drug abuse fuels crime, unemployment, and poverty. When people can no longer hold jobs or contribute positively, they may resort to theft, violence, or even prostitution to support their addiction. In fact, studies show that communities with high drug abuse rates also struggle with higher levels of crime and insecurity. Now, let us address one major myth. Many people believe addiction only happens to weak people or those with no discipline. This is false. Addiction can happen to anyone from the richest to the poorest, from highly educated professionals to school dropouts, from urban centers to rural villages. Drugs do not discriminate. In fact, many successful individuals who look perfect on the outside were silently battling addiction inside. Another important issue is prescription drug misuse. Many people assume that because medicine is prescribed by a doctor is safe, but when medications like opioids or painkillers are abused, they can become highly addictive. Opioids, for example, have been responsible for millions of deaths, especially in countries like the United States, where the opioid crisis has devastated families and communities. So what can be done? Prevention is always better than cure. The best way to stop drug abuse is to never start in the first place, and prevention comes from awareness, education, and strong support systems. Schools need to educate children not only about the dangers of drugs, but also about how to build confidence, resist peer pressure, and make healthy choices. Parents must maintain open communication with their children, because silence or judgment can push young people toward risky behaviors. Communities must provide recreational activities, mentorship, and counseling so young people have positive outlets instead of negative ones. For those already struggling with addiction, there is hope. Recovery is possible, but it requires patience and support. The first step is acknowledging the problem. Many addicts live in denial, telling themselves they can stop anytime, but in reality, the drug is in control. Seeking professional help from doctors, therapists, or rehabilitation centers is essential. Therapy can include detoxification, counseling, group therapy, medication-assisted treatment, and spiritual or faith-based guidance, depending on personal beliefs. Recovery also requires strong social support. Families must be patient and encouraging instead of shaming and rejecting. because isolation often drives people deeper into addiction. Now, let us talk about the mental health connection. Many people turn to drugs to escape stress, anxiety, trauma, or depression. Drugs provide a temporary escape, but worsen the very problems people are trying to run from. The cycle of using to escape only creates deeper pain and suffering. This is why addressing mental health openly is key. When people have healthy coping mechanisms like exercise, meditation, journaling, or counseling, they are less likely to rely on substances to feel better. Governments and organizations also play a vital role. Strict regulation of drugs, strong anti-drug campaigns, community rehabilitation programs, and access to affordable health care can make a huge difference. Unfortunately, in many developing countries, drug abuse is rising because awareness is low, support systems are weak, and stigma prevents people from seeking help. If we want to fight this problem globally, we must break the stigma of addiction, stop treating addicts as criminals or failures, and instead view them as people in need of help, understanding, compassion, and healing. Let us not forget the role of peers. Friends can either be the strongest protective factor or the greatest risk factor. If your friends encourage you to try drugs, chances are you might. But if your friends push you to focus on school, fitness, hobbies, or personal growth, you will more likely resist temptation. This is why young people must choose their circles wisely. The saying is true: show me your friends, and I will show you your future. Before we wrap up, let us provide some practical tips. If you are someone trying to stay away from drugs, remember 5 key things. Number 1, know your triggers and avoid them, whether it's certain places, people, or situations that pressure you into using. Number 2, build healthy routines. Stay busy with school, work, hobbies, or volunteering. Idleness often creates temptation. Number 3, take care of your body. Exercise regularly, eat nutritious food, sleep well, and drink water, because a healthy body supports a healthy mind. Number 4, seek help early. If you notice cravings or habits forming, do not wait until it is too late. And number 5, surround yourself with positive influences, mentors, family, faith groups, or support networks who want to see you grow and succeed. To conclude, drug abuse and addiction are among the greatest threats to our health and communities, but they are also preventable and treatable. Every person listening has a role to play, whether you are a parent, a teacher, a leader, youth, or friend. You can be the voice that discourages someone from taking their first hit, or the support that helps someone find recovery. Remember, addiction is not the end of the story. Many have recovered, rebuilt their lives, and now live free from the chains of substances. The same is possible for anyone who chooses awareness, action, and hope. So let us continue spreading this message. Let us encourage open conversations. Let us push for prevention and rehabilitation. And let us stand united against drug abuse. Together we can save lives, restore families, and build stronger, healthier communities. This is Health Horizon. Don't forget to hit subscribe and share to inspire a healthier world together.